Welcome, and thank you for joining us today for hashtag SWHR Talks HPV, Vaccination for Cancer Prevention. I'm Irina Niñe, Chief Science Officer for the Society for Women's Health Research. SWHR is a thought leader in promoting research on biological sex differences in disease and improving women's health through science, policy, and education. In the United States, 85% of people will get human papillomavirus or HPV infection within their lifetime. In fact, HPV is the most common sexually transmitted infection. While many HPV infections will clear naturally and without issue, persistent infections caused by certain types of HPV can lead to serious diseases such as genital warts and cancers, including cervical, vaginal, vulvar, penile, anal, and oropharyngeal or throat cancers. Fortunately, the HPV vaccine is a highly effective method in preventing many of these cancers and reducing the overall spread of the virus. Recognizing that women are often the primary medical decision makers for their families, SWHR has created a host of educational resources to help women engage in productive conversations about the HPV vaccine with their family, healthcare providers, and their communities. SWHR's vaccines program was established to address barriers to information and access, and to reduce health disparities through the development of educational materials designed to reach women as immunization recipients and decision makers. Over the past year, SWHR has convened an HPV vaccine education working group of researchers, healthcare providers, and community leaders with expertise in public health, vaccine science, HPV, and related cancers, all committed to cancer prevention through the HPV vaccine education and uptake. This group has been instrumental in the development of resources SWHR has and continues to share in this topic. We're pleased today to have 4 amazing panelists, some from the working group, joining us to share their expertise about HPV, the vaccine, and cancer prevention. Dr. Litjin Tan, Chief Science Strategy Officer of Immunize.org, Dr. Shilpa Naval, Associate Professor of Dental Public Health and Policy at Virginia Commonwealth University, Kimberly Williams, Chief Diversity, Equity, and Inclusion Officer at Survivor, and Lillian Kruppel, Co-founder and Executive Director of HPV Cancers Alliance. Following the speaker presentations, I will be moderating a discussion with all of our panelists, so we invite you to use the Q&A function to submit questions throughout the event. I would also like to thank the sponsors of today's event, Merck & Company. As always, we will be live tweeting, and we invite you to use the hashtag SWHR Talks HPV and SWHR Talks Vaccines on all social media. Now I'll introduce Dr. LJ Tan, who will start us off with an introduction to HPV and how the HPV vaccine is important for cancer prevention. Thanks for joining us, Dr. Tan.
Oh, thank you very much, Irene, for this opportunity here. And I am delighted to be here to kick this panel off. And I'm going to go ahead and share my screen. While I'm doing that, I'm going to just quickly make a couple of quick disclaimers. I am presenting here as an expert on HPV vaccination. Any kind of information I give is based on my expert opinion, may not necessarily represent official positions, for example, of my employer, Immunize.org, or perhaps of the National Adult and Influenza Immunization Summit that I co-founded and co-chair. So just to keep that in there. Okay, so I'm going to confirm before I go further. Irene, if you can just verify, you can see my slides and you can hear me.
Yes, we can. Thank you.
Wonderful, wonderful. Okay, so I'm going to go ahead, and my job is to kind of kick us all off with some of the basic science about HPV and HPV vaccination, and then I believe I'm going to be handing it off to I think Dr. Naval, who's going to talk a little bit more about oropharyngeal cancers. But just to kind of remind all of us here, what is human papillomavirus, or what we call HPV, right? Just to remind us that it is a sexually transmitted infection, fairly common sexually transmitted infection, and that infection in most people occurs soon after first sexual activity. So after the debut of sexual activity, we tend to get infection with HPV. And it is important to remember that most HPV infections do ultimately basically resolve without significant impact. But also to remind ourselves that half of these infections are of a high-risk HPV type. And I think it is important to also remember that HPV as an infective agent does not discriminate based on sex. It does not discriminate on gender identity or sexual orientation. And so what we're really concerned about, obviously, are what we call HPV-associated cancers. And again, Irene had mentioned some of those already. And to remind ourselves that these HPV-associated cancers result from persistent infection with a high-risk strain of HPV. And again, just to go through the list again, cervical, anal, penile, vaginal, vulvar, and oropharyngeal cancers are all obviously HPV-associated cancers. And one of our challenges, obviously, is that cancer can take years, even decades, to develop after a person first gets infected with HPV. And so that's something to keep in mind. And of course, in terms of prevention and measuring the value of the preventive effort of vaccination, the benefit of prevention with vaccination will only show up years or decades following the start of a vaccination program, right? Because again, cancer takes several years may take years or decades to develop. What we do know, however, is between 2012 and 2016, and this is United States data, there were about 35,000 cancers that were attributable to HPV, and 92% of those cancers were attributable to the types that are targeted by the vaccine I will soon talk about, which is the 9-valent HPV vaccine. Just to remind us about cervical cancer in women, and I think you'll hear a little bit more from the rest of our wonderful panel later on, 200,000 cervical precancer cases resulting in about 11,000 cervical cancer cases itself, which results in about an average of 4,000 deaths. So, and this is every year. So I think again, the mortality and morbidity as a result of HPV-associated cancers, and for example, cervical cancer in women cannot be doubted. And if you're not convinced of the importance and the impact of HPV disease based on morbidity or mortality, I'm also going to show you some quick hard-hitting points regarding the economic impact of HPV vaccination, HPV disease. So HPV attributable cancer deaths are associated with a substantial economic burden in the U.S. And just some numbers here. About 7,000 cancer deaths occurred in 2017, which resulted in about 155,000 years of what we call potential life lost. So people whose lives were lost, and that potential life lost, about 155,000 years. About 6,500 deaths and about 142 years of potential life loss were attributed to the types that are targeted by the vaccine. So about 91% of these lives lost and deaths as a result of HPV are protected by the vaccine that we currently have. And I think the other thing to highlight here is the estimated present value of what we call future loss productivity. That means the productivity, the value to society in terms of dollars was 3.8 billion for cancer deaths that are attributable to the 9 vaccine strains that are in the vaccine, and 84% of that value lost, that future loss productivity, was from women, and that's in 1 year. So hopefully this gives you an idea of the severe impact of HPV on morbidity, on mortality, and also in terms of economics. And we do have a vaccine that can protect against 9 types of HPV infection. And reminding ourselves, HPV 16 and 18 account for the majority of cancers that are HPV cancers, about 70%, and that it also protects against 5 additional high-risk cancer types, the 31, the 33, the 45, the 52, and 58. And so as I mentioned earlier, together, this protects about 91%, against 91% of strains that are responsible for HPV-associated cancers. And then there are 2 other strains, HPV 6 and 11, that are also in the 9-valent vaccine that protects against the HPV. Those are types that cause anogenital warts, and therefore the vaccine also protects against anogenital warts as well. And it's important to remember with the vaccine that prevention is not treatment. Once you get infected with the HPV type, the vaccine will not cure that infection. And then just to kind of assure all of us that what we have is a vaccine that's highly effective. And this is data that's accumulated over the last 15 plus years that the vaccine has been approved and actually been monitored as well. So first, to remind us, clinical trials data have indicated that HPV vaccines are about almost 100% effective at preventing persistent cervical HPV 16 and 18 infection. And remember, the data started with the 2-valent vaccine, it went with the 4-valent vaccine, and then now obviously we have 9-valent vaccines out there. And when I say 9-valent, I mean that's the number of types that the vaccine protects against. In 10 years since 2006, when the vaccine was approved, what was remarkable, and this is just building, right? Remember I told you, it takes years for cancer to pop up. And so therefore, measuring the benefit of vaccination will also take that same amount of time. But in the 10 years since 2006, when the vaccine was approved, we saw a reduction of 80% in the vaccine type HPV infections. So that means the types that were protected by the vaccines, we saw an 86% reduction in females, teens 14 through 19, and about 71% reduction in those same vaccine type HPV infections in women in their early 20s. So again, we're already beginning to see the incredible impact of vaccination, the incredible effectiveness of this vaccine. The other thing is what we've also seen is that now that we've monitored this vaccine for more than 10 years, we have found no evidence that the protection decreases. So it appears to have durability. And so right now, there does not seem to be a need for any booster doses of this vaccine. However, because, as I mentioned earlier, the vaccine, the 9-valent vaccine that protects against 9 strains, only protects against 91% of all the strains that can cause cancer. Women who have received the vaccination series need to still be screened for cervical cancer beginning at the age of 21. And just finally, to also remind all of us that this vaccine is extremely safe. We had the clinical trials, very few serious adverse events, no vaccine-related deaths were reported. And then obviously, we have now been giving this vaccine, not just in the United States, but around the world. And in the United States alone, with more than 135 million doses of these vaccines distributed in the US, there is now very robust safety data. And what we do know is that with the exception of fainting, which is more common among adolescents after receiving any vaccine, not just HPV vaccine, there have been no confirmed adverse events occurring at higher than expected rates following HPV vaccination. And as many of us know, the most common side effects that have been reported associated with HPV vaccine include things like pain at the site of injection, redness at the site of injection, some dizziness, and as I mentioned earlier, fainting. So again, a very safe vaccine, a very effective vaccines. And as a result, we have these recommendations from the Advisory Committee on Immunization Practices for protecting our population against HPV infection. So routine vaccination is recommended for both boys and girls starting at the age of 11 through 12, although you can start as early as 9 years of age. And then there's catch-up recommendation that is recommended for boys and girls if they have not got their full series between the ages of 11 and 12 with part of routine vaccination. And so between the ages of 13 to 26, we recommend that these boys and girls or men and women between the age of 13 and 26 be adequately vaccinated and caught up against HPV vaccination HPV vaccination. And then for adults 27 to 45 years of age, we have what we call a shared clinical decision-making recommendation, which means that you might benefit from getting the vaccine. And so therefore you should have a conversation with your healthcare provider to see if you would want to get vaccinated against HPV. And so my final slide here, just to remind people of just a little more detail, granularity on what I just showed you. A 2-dose schedule is recommended for people who get the first dose before their 15th birthday. And this is because the vaccine is a little more effective in younger children. And in this 2-dose series, the second dose is given about 6 to 12 months after that first dose. If you turn 15, and you're older than 15, then you need 3 doses, and that is what's recommended. It is also recommended for people with certain immunocompromising conditions that make their response to the vaccine a little bit more compromised. And then finally, and this may pop up in some of the questions about new data that's coming out. There is new data, recent data that indicates that maybe a single dose of HPV vaccine is likely to be effective with at least a duration of immunity of about 18 months. This is very recent data, hence that duration is still very short, 18 months. But as this data continues to come out, I think you'll begin to see whether there's consideration of whether we'll be moving to a single dose of HPV vaccine, at least globally, and maybe even within the United States. So I want to thank all of you for having me here and giving me this opportunity to present to you all. And I'm going to stop here and turn this back over to you, Irene.
Thank you so much, LJ. Next, we will have Dr. Shilpa Naval discuss the involvement of HPV in oral health in cancer field.
Thank you. Hello, everyone. Thank you for joining us today. And thank you, LJ, for setting up the stage and kind of sharing all the information about the vaccine. I'm going to go ahead and share my screen, and then I am going to talk about the other side of the story, which is about the cancer part. HPV is associated with many cancer, as we learned about. And one of them, the common one, is oropharyngeal cancer. However, not much is known about it, and not kind of enough information sometimes is available. So we are going to spend some more time on oropharyngeal cancers today in my talk. So first of all, when we talk about oropharyngeal cancers, thinking about oral cavity and oropharynx are kind of two parts. The oral cavity is like this front area, but when we talk about oropharynx, this is the soft palate, the side, the back of the throat, the base of the tongue, and tonsils. And most of the time, as we are getting data every year when we monitor it, we see that variety of cancers are decreasing. However, oropharyngeal cancers have seen some increasing trend, and most of them are HPV positive cancers. So they have increased almost 1.3% among women and about 2.8% among men during the last 4 or 5 years time period. So giving a little bit more bigger background of oropharyngeal cancers along with oral cavity cancers together, because most of the time we are talking about them together, recent estimates shows that about 55,000 new cases of these cancers, both combined together, oral cavity and oropharyngeal cancer. And we'll get to the number of oropharyngeal cancer in the next slide too. And the burden of this disease, the cancer, is about like around 12,000 deaths in every year. Most common type of these cancers that occur are squamous cell carcinoma. So its survival rate and other things are kind of also dependent on what type of cancer it is. Oral cavity cancer typically have good survival rate, but oropharyngeal cancer survival rate, if it is examined or identified in a local stage and is not spread out to other parts of the body, it's about around 60%. But if it has spread, it reduces almost to half, which is about 30%. So that kind of tells us, again, the burden of the disease. So bringing together the HPV and oropharyngeal cancer, as Dr. Tan mentioned, HPV is one of the most common sexually transmitted infections and has become a leading cause of the oropharyngeal cancers. Almost 70% of oropharyngeal cancer, or OPC, what we like to call in an abbreviated way, are attributable to HPV. So of all the oropharyngeal cancers that happen, 70% are HPV positive. Of those, like how previously you heard, there are multiple strains of HPV cancers. The most common are 16 and 18, which are targeted by the vaccine, and 90% of OPCs are caused by those two strains. So again, the effectiveness of the vaccine is really high because we know most of those cancers are caused by that strain. Another fact about oropharyngeal cancer is that these oropharyngeal cancer numbers have increased in past 10 years and really surpassed the cervical cancer numbers. So oropharyngeal cancers have now become one of the most common HPV-associated cancers, and we'll see the numbers in the next slide. And then on top of it, oropharyngeal cancers are more common among men, almost 5 times compared to women. Cervical cancers, as we see, are very common are among women, but oropharyngeal cancers occurrence we are seeing much higher among men compared to women. So here are those numbers that I was talking to you about. These numbers come from 2013 to 2017 data. And as you see, here's the cervical cancer numbers, and here's oropharyngeal cancer numbers among females. So among females, we see it's about around 2,100. And among males, that number really grows almost 5 times higher. And so really a major concern among males. And if we, those of us who like numbers, if we see in terms of numbers, about 20,000 oropharyngeal cancers in total are found, of which 70% are caused by HPV, so about 14,000, and of those, about 12,000 are caused by that 16 or 18 HPV strain. So again, a heavy emphasis on the vaccine because vaccine does target those strains. So now kind of talking about what are the signs and symptoms of oropharyngeal cancer and how can it be detected. Oropharyngeal cancers are really in some ways hard to find because as you saw in that picture in the beginning, they're in the back of the throat and that area is not as visible. Typical symptoms or signs, you could see red and white lesions like how in the back of the throat here you see ulceration in the back, persistently having a sore throat, dysphagia. These are all the signs. Most of the time, cervical lymphadenopathy because the cancer spreads through lymph nodes. So in the neck region, that is a place where they are going to try and examine to see, but again, visual examination can be harder to find in the localized stage sometimes. So having regular checkups, dental appointments, because during those appointments, many a time oral cancer screening is done, where intraoral and extraoral by examining your lymph nodes and everything could be a way to identify it. There's no approved screening test like how for cervical cancer we have Pap test, but for oral HPV, we do not have a screening test. And therefore, it becomes further important that if we have a vaccine which can prevent HPV infection, that could be a really a game changer, a lifesaver among those, especially when we know that oropharyngeal cancer does not have that screening. So prevention is better than cure. Now thinking about kind of this signs and symptoms and everything and bringing it together with the vaccination rates. So typically, as a healthy people objective for the nation, there are a variety of objectives in different areas of health. For vaccination, especially for the HPV vaccination, our objective is to increase the proportion of people who have this vaccine to 80%, so that we can have that immunity as a population level measure. In 2021, we've been monitoring data for years and looking at the trends. The trends are looking good and they're going in the right direction. However, we are still below what is required of that 80% that we are trying to reach to. So in 2021, up-to-date vaccination rate, up-to-date meaning having a required amount of doses, like how Dr. Dan was telling about 2 doses or 3 doses, depending on when you take it. So among females is about 64% and among males is about 60%. So males kind of are below vaccination from females, and then obviously below that mark of 80% that we are trying to reach. So we have still ground to cover in that area. So thinking about the HPV vaccine policies and oropharyngeal cancers and dental care providers, American Dental Association, which is the professional organization for dentistry, they have passed a policy in 2018 to recognize the importance of this vaccine and recognize how important it is to prevent this infection so as to reduce the occurrence of oropharyngeal cancers. And it has urged dentists and dental providers to support the use and administration of this vaccine where possible. In 2020, also, the vaccine was in the beginning approved for cervical cancer, but the FDA had added as oropharyngeal cancer also as a prevention and an indication for the vaccine. So now it's also approved for oropharyngeal cancer, and rightly so, as we saw that 16 and 18 and those cancer related strains are targeted by that 9-valent vaccine that we heard about. And HPV vaccine, because of its effectiveness and kind of knowing all the information, can prevent 90% of cancer. So imagine the amount of burden of disease, the quality of life, the cost to healthcare system it can reduce, because it means fewer cancers, fewer cervical cancer, fewer all types of oropharyngeal cancer, anal cancer, any cancer that is associated could be 90% less. But at the same time, as we see this data of how the numbers are different and we are not up to that stage yet of that 80%, we really want to understand and make sure that those who are eligible in the age range and have to take the vaccine can get this right information to them. So I'm going to tie this up with how we think and what role each one of us has to play as a patient, as a provider, as a other member, every member in the community. So for patients, it's really important to discuss the HPV vaccine. If you don't know about it, ask about it. Talk to your dental provider, talk to your medical provider, any healthcare provider. It's recommended, as it was shared, between 11 to 12 years of age, but can start at 9 years of age. So if you have a kid, talk about the vaccine and get yourself informed about it. For dental providers, it's important to perform those head and neck exams that I mentioned to examine if there's anything that looks suspicious. Making sure, again, that provider also initiate those conversations, discuss it with their patients, and keep themselves informed and expanding, kind of educated on the topic so that they can provide the right information to the patients. And especially knowing this, how oropharyngeal cancer rates are increasing, it really becomes very important to make sure that all these providers kind of understand and educate patients on all parts of it. Similar thing for medical providers, making sure they recommend and provide vaccine because they are the ones who can vaccinate. Dentists can vaccinate in a couple states, but not every state, but they definitely can educate and discuss and share information, and making sure that also emphasizing that this HPV vaccine does not discriminate between boys and girls, or the cancer does not discriminate, infection does not. So having vaccine to both boys and girls is important, and increasing that. And then thinking about medical dental integration, which is the area where I work heavily in how can we work together to make sure that we achieve the common goal, close the gap of information which is there among people, among providers, everybody, to make sure we all are educated and have right information. And then within medical and dental provider, providing referrals from dental provider if they have a patient in their chair, which is the right age, sharing the information and then saying, go see your doctor to make sure you make a vaccine appointment. And same thing with the medical provider, if they see the patient and they want to make sure that they understand the importance of oral health and HPV prevention together, kind of making those connections together. So with that, my last slide is that we all need to work together to make sure that this gap of information is closed, and we all have a role to play to reduce the burden of this disease among young and old. So thank you so much for listening to me, and I'm going to pass it back to Dr. Annie.
Hello, thank you, Shilpa. We appreciate your thoughts. And so we've gotten these provider and prevention strategies from you and LJ. And I want to make a note to those that are tuned in live that you can submit questions at any time using the Q&A function. And we will try to address as many as we can during the panel discussion portion of this event. Next, we'll have Kimberly Williams, who will share her personal journey with cervical cancer, her insight and tips for engaging in productive conversations about the HPV vaccine. Welcome, Kimberly.
Thank you. Thank you so much. Again, I'm Kimberly Williams. I am the Chief Diversity, Equity, and Inclusion Officer for Survivor, Inc., which is an organization for cervical cancer patients, survivors, and thrivers. Next slide. I am also a cervical cancer survivor. Just to give you a little background about me, in March of 2018, I was initially diagnosed with cervical cancer 1B2. I was 42 years old, a director at the time, and a wife and mother of two. And my diagnosis, they were telling me that it was caught early. And so I was blessed to have it caught early. I would have a radical hysterectomy and everything should be good. After my surgery, there was some cancerous cells that were found on the outside of my cervix. And they stated that I needed like a maintenance radiation and chemo. My insurance did not want to pay for additional scans to identify where the cancerous cells may be. And not until April of 2019, over a year later, I was able to get one scan, which identified that I had a recurrence at that time. So I had to educate myself on HPV and everything like that so that I would be able to gear up for this aggressive radiation and chemo treatment that I had to go through. So in August of 2019, when I dropped my children off for school, I started my journey of radiation and chemo treatment. In December of 2019, I rang the bell and also received my first no evidence of disease. And I have since been NED since that time, but it did spark interest in me in reference to this. Next slide. So I found my voice. And in this slide, you see where I've been speaking and sharing my story because I don't want any other woman, child to go through the things that I've gone through with this diagnosis. I was never told that I had HPV. I was told I had cervical cancer. So not until I joined Survivor did I see that, oh, wait a minute, I could be one of the ones that had HPV, and for sure I was. And so because of that, I felt like sharing my story was so important because it helps people to know that this is an issue that we can address together. Next slide. And so a little bit about Survivor and why I'm so vocal. We are a global community of patient advocates who inspire and empower those affected by cervical cancer by educating and motivating them to use their voices for creating awareness, to end stigma, influence decision and change, and end cervical cancer. Next slide. We are working to close the disparity gap. And as we're looking at vaccination for cancer prevention, I look at this, I take this very seriously because my children, when it was time for, well, specifically my son to be vaccinated prior to my diagnosis, the physician did not explain what the HPV vaccine was. She stated, do you want him to have the HPV vaccine? I asked, was it necessary? Did he need it? And she shrugged her shoulders and told me, not really. We have to work on communication, especially with parents, so parents understand that this vaccine is cancer prevention. And when we work to close the disparity gap, we're definitely working towards that by communication and by making sure that people are aware and understand the vaccine and its importance. Next slide. And so again, we as an organization are addressing cancer disparities, and that's through increasing screening rates and also encouraging HPV vaccination and encouraging clinical trial participation. And so we believe that with these things, we can work to end cervical cancer. Next slide. It slowly popped up, but this is how you can communicate with me and keep in touch. If you have any questions or you want any additional information, you definitely can reach out to me directly. So this is how you can reach me. And that is my story. So I will give it back to you, Dr. Irene.
Thank you so much, Kimberly. Last but not least, Lillian Kruppel will share insight from her journey with anal cancer and how she was inspired to become an advocate for HPV cancer awareness.
Hi, everyone. Thanks for having me here. I'm very excited to be on this robust panel with all these great panelists and to be part of the Society for Women's Health Research webinar today. So I'm going to pull up my slides. All right. So almost 6 years ago, I had anal cancer and I knew I had HPV. My gynecologist had told me that I had HPV when I've gone in for my routine pap tests, and she said, you know, you have abnormal cells. Come back, you'll get the colposcopy, and then we'll see if the HPV is still present. So at least I knew what HPV was, because I do know that a lot of people have no idea what HPV is, and the doctors are not necessarily telling them you have HPV. Anyway, so then, so I was fine. The colposcopy said I was fine. And then that was it. Just kept getting my tests every year for my pap tests. And then in the summer of 2017, yeah, almost 6 years ago, I had some blood, from the back area. Not a lot, but it was consistent. And when I went to see that same gynecologist who I've seen forever, she said to me that I was fine. And I said, I'm not fine because there's blood. And then I went to see someone else and they caught what was stage 2 tumor for anal cancer. And I asked that doctor, what did you do that my gynecologist didn't do? And she did give me a digital rectal exam, which thank God she did, because she said that they should be doing that. And I can tell you that 90+% of people that I know, their GYNs do not do rectal exams. And if they do it, some of them don't know really. I don't know if they're sure, what they're looking for. I'm not 100% sure on what, if they are doing the complete test, because my GYN did the test and didn't catch it. So what did my other doctor do that she didn't do? He palpated. So he used his fingertips and he circled around and he found a hardening that many doctors think, if they're even checking, is a hemorrhoid. Because often anal cancer gets mistaken for a hemorrhoid, that, oh, you have a hemorrhoid. And you know what? Most patients, they don't even want to go to the doctor, and they're going to go home and be happy with that. But I knew something was wrong. So I went to someone else and they caught it. And then when I started to go through the treatment, which was pretty intense treatment of radiation and chemo, I realized, by the way, I went back to my gynecologist and I said, hey, this is what I have. This was missed. And she said, it's not my area. And then when I started to meet other patients and started really getting into this whole anal cancer community, because I didn't even know there was a community. I never really knew about anal cancer. I mean, I knew Farrah Fawcett died of it. But anyway, so then I realized, like, that is the answer, that, well, it's not my area. And so I thought, oh, wow, there's a lot of gaps around this topic, around HPV, around anal cancer, around the other 5 cancers that are caused by HPV. And the average person has no idea what HPV is and that it can cause cancers. And especially in my age range, mid-40s and up, we didn't get the vaccine. So I felt like we really need to highlight this and tell everybody about this, because it's the most pervasive virus out there and we must know about it, and we must, be armed and be educated and not caught with this cancer, because it's nobody should die from these cancers, from HPV. So I decided to create this organization, the HPV Cancers Alliance. And what we do is we spread knowledge to save lives. And so when I was finished with treatment, here I am. I had this big party, and you see people have like angel things on their head because they were my angels. And the party was really to thank all the doctors for saving my life. But it turned into a much funner, better party. So I'm just going to click on this. I don't know if it'll work, but no, it didn't. It didn't work. I guess the audio the video didn't play. I don't know why, but anyway, here's some clips of my party. And here's some more, of the party. I had a lot of people there, and, we had a lot of fun. We had this over here is like the piñata in the shape of a butt. And then I had toilet paper centerpieces. I had all kinds of funny things to bring light and levity to a topic that people don't want to talk about. And I even had someone there from the Anal Cancer Foundation to talk about HPV, and she had lost her mother to anal cancer, and I had her speak about the importance of vaccine and taking care of yourself. And then, sorry, I'm racing through this here. So here's what we created a few years ago, and I created it here with my friend, the actress Marsha Cross. And this was just a few weeks ago. We actually went to Capitol Hill. We did a day on the Hill to garner support from Republican House members for this Prevent HPV Cancers Act, so that people know about HPV and people know that there is a vaccine out there. And like Kimberly said, HPV vaccine is cancer prevention. So we had a wonderful day. We met with 11 House Republicans, and here was our group. We had 10 people with us, and we split up into two groups, and we met with 11 House Republicans, and it was fantastic. And if you want to get in touch with me, here's how you can get in touch with me. And what I want to also mention is how you can get involved and how you can advocate. So if I'm just going to turn the slides off. Okay, let me stop the sharing the screen. How do I stop the share screen? 1 second. Here we go. Stop sharing. Okay, here we go. Sorry about that. So here's a couple things that I did that saved my life. If you know your body, and if you know something's wrong, and you go to the doctor and the doctor's like, no, it's you're this or that, just go to someone else. It's good to get a couple of opinions, especially if you know your body. Just like when the doctor said I was fine, I knew I wasn't, and I went to someone else, and thank God they caught it. So you definitely need to advocate for yourself, and you need to advocate everybody everybody has kids, friends of kids, and nieces, nephews, grandkids. Talk to everybody that you know and let them know, hey, it's this almost like a secret saving their lives. Like, did you know what HPV is? Did you know that there is a prevention for it in the form of a vaccine? And by the way, I did get the vaccine at age 52. And the reason I got it was because there are so many strains of HPV. I thought, well, let me get this vaccine. Maybe it can protect me against some strains that I don't have. So I would absolutely urge you to get involved by taking ownership. I owe it to, because of what I went through, I owe it to society to save lives. And I think that it's very important for you to get out and speak to everybody that you know about the vaccination. And if they're hesitant, let them, get educated from HPV Roundtable. There's various organizations, American Cancer Society, that has information. Here, Society, SWHR. Regarding the screening guidelines and prevention, I can say that personally, I am getting a PAP test every year. I know I don't think the guidelines are calling for that unless you have high risk HPV. But the way I am, I'm going for a pap test every year. And a way that I advocated for myself recently when I went to see a new gynecologist was she did a rectal exam. And I said to her, "Was that your rectal exam?" And she said, "Yes, why?" And I said, "Because it just seems so fast. I mean, not to be, graphic, but you need to really go in there. There's folds, there's all kinds of things you really need to check." And I think she was uncomfortable. So, yeah, I needed to find someone else who really, who does the digital rectal exam, a complete rectal exam. So I say, know your body, advocate for yourself, advocate for your loved ones and anybody, talk to people about it, and definitely get involved, because we can save lives and we can bring this pandemic of HPV cancers down and hopefully done. Thanks, everybody.
Thank you so much for sharing your story, Lillian, as well as Kimberly. And so we've set a wonderful stage, I think, for the Q&A portion of this event. I invite the panel to all turn on their videos as we enter this Q&A. Again, attendees, we invite you to submit questions using the Q&A function, which is usually at the bottom of your screen. We'll try to address as many individual questions and common themes as we can over the next about 15 to 20 minutes. But we apologize if we can't get to all of them. And so to open up the conversation, Lillian kind of mentioned something about, she mentioned, getting the vaccine at an older age. And LJ, you talked about shared decision making. So can you get a little bit more into that? What does that involve? Like how is it brought up? What goes into that conversation with the provider?
Yeah, so the shared decision-making recommendation, thank you for that question. And it's a good conversation point, Lillian. So thank you for bringing this up. It's between, for adults 27 to 45 years of age. Now, remember, the vaccine is licensed older than that. But that being said, that's the recommendation. And what shared clinical decision-making is recognizing that not all women might benefit, or men might benefit from vaccination, let's say at age 44. But some might. And so what the advisory committee did, recognizing recommendations are at a population level, but treatment, medical care is individual, is that they wanted to keep that open and allow a provider to have a conversation with a patient saying, hey, you're maybe at higher risk because of whatever, right? I mean, it could be sexual activity, it could be anything. But because of that, I want to give you the vaccine. The shared clinical decision-making allows for that to happen at the individual level, while recognizing as a population, it might not be the most cost-effective way to intervention for that population.
And Lillian, so what did that conversation actually look like for you? Oh, you're muted. So.
Okay. So I was so curious, because I thought, oh, there's so many strains of this cancer of HPV. Obviously when you have cancer, everyone's always worried, well, will it come back? Will it come back? And I thought, you know what? There's so many strains of this HPV. Maybe let me get the vaccine. Maybe it'll protect me against, another strain. And I asked my oncologist, and he said, yes, you can absolutely get it. And I went to my gynecologist and I got it. But I can tell you that I've had many women call me, and they're in their 40s and they're divorced, widowed, whatever it is, and they want to start a relationship. And they've said to me, oh, my nurse practitioner said I can only get it till I'm 27 or 26. And I'm like, this information drives me nuts. And that's why I'm going to one of the nurse practitioners conferences with Marsha to talk about this, because this kind of lack of information, it drives me insane. And then I said, really, why don't you tell the nurse this? And here, why don't you tell the nurse practitioner this? Here's the information. Where's she been for 4 years? I just don't get it.
Yeah, I think that's so important. Self-advocacy, Lillian. Thank you for bringing that up. I mean, to just kind of not, to realize that, providers are really busy, and it is important that, if you know something, bring it up, and and hopefully the provider will then say, hey, I better go read up on that and make sure I'm doing the right thing by all the other patients. So yes, definitely. Thank you.
Thank you so much. We
I
have
can tell
some
you,
questions.
I don't know what, I'm sorry, I can tell you, I don't know what's going on, but they're not getting the same memo.
Yes, we have some questions that have come in, and there's one for Shilpa. Dr. Naval, this was, I thought, we really are glad to get this oral health perspective, because HPV is always, typically looked at in gynecologic health or, anogenital cancers. And so are there more concerted efforts being made to reach, I know you touched on it, but ENTs, ear, nose, throat, as well as in the dental field to promote HPV vaccine? If you want to kind of expand on that, or any kind of collaboration, or, what would you be able to offer to those other healthcare providers that might be on this, listening to this?
Yeah, for dental providers, I think there has been a strong effort going on through a variety of organizations, such as HPV Roundtable, such as American Cancer Society, to make sure that the message is clear and singular in terms of understanding that the cancer would not differentiate and could occur in so many different places. So making sure that people are educated about it. And dental provider, as I shared, are not allowed to give vaccine because the vaccination, providing vaccination directly has not been the policy. And so a couple states are doing it, but a lot of work, even through American Dental Association, is going on in educating dental providers to make sure that they are able to talk to patients, discuss this. But again, change takes time and kind of everybody to come up to the speed, but a variety of continuing education activities and things are going on, such as yours. And I'm hoping that these kind of add to some more people who probably have not known this information and expand it. To your second part of ENT kind of specialist and otolaryngologist, I think I don't have much information on how much is their involvement, but I think that's a no-brainer. They should be involved because that's the area of their work. That's the area where they are kind of seeing things, and potentially, I think, making sure that they do the same kind of coordination and connection of care, so that if they are not giving vaccines, they make sure that that referral, or if that is kind of happening with their primary care provider, they can connect the dots and make sure that their patients who are coming to them are getting those vaccines. They're asking about it, because again, the more we talk about it, like how Lillian was sharing, how Kimberly was sharing, if we talk about it, then only we'll know. Otherwise, that information kind of, people seem like everything is separate, but it's not. It's one body, it's one thing, and one vaccine that could help in those 6 types of cancers. So I think if all of them are kind of talking the same language, it becomes very clear for the patient as well as to kind of follow recommendation, know about it. But again, I think a good amount of work is going on in those areas. And as my own work, we've been kind of trying to engage and educate our dental care providers to make sure that those conversations happen.
There's a question I want to direct, and maybe Kimberly, you can touch on this. There's physical impacts, of course, of cervical cancer, HPV-related disease, but women with HPV-related cancers also potentially face stigma associated with the diagnosis of that cancer. And so what is your experience? And I know you have your own, but also with Survivor, how women kind of manage that, or what advice would you give on addressing that?
Absolutely. A stigma is definitely associated with any of the HPV cancers, regardless if it's a male or female. Definitely with women, they tend to associate us having multiple sexual partners, being promiscuous, and those type of things. what we encourage women to do is to make sure that they're educated on HPV, and also to educate that person that is saying things to them. And that's what I found myself doing. I don't necessarily look at it as even though there is a stigma there, I don't focus on the stigma. I focus on education. How can I educate the public? Because if someone is coming to me and they're using this type of language, that means they're uninformed. And if I just stay in the place of information and providing information versus being torn down by a stigma that they're trying to place on me, then I feel like we're in a better, in a better place, for lack of better words. So that's what we usually tell our survivors. Find that information and share that information, because the more we share, the more knowledgeable the general public is as it relates to HPV.
And LJ, and do you know from immunize.org and from your role on the provider side, are there any efforts that have been, widely shared or something as far as from the clinic perspective to address that stigma and that burden for women?
Yeah, I think it's interesting that I think you're at ACOG. I think obviously a lot of the work has to be done through the OB/GYN providers. We do have talking points, and in fact, we have a lot of good talking points specifically for actually adolescent health, believe it or not, because a lot of that, that's where a lot of that focus has been. I think it is important to recognize that we probably do have this gap that Lillian has pointed out and Kimberly both pointed out with the younger women that are coming out of that recommended age group. So we've been really focused, right, on getting the people who are recommended vaccinated, that we've kind of lost track of, a little bit of the 19 through 26 even. And specifically, we definitely have kind of not paid as much attention to the 27 and older. And so I think you're right. I think that's a gap. I think we need to be providing a little bit more assistance to the providers who take care of these slightly older women and make sure that they are aware of the choices that are, that are available. I think it's too easy to keep focusing on obviously the 9 through 11 where we're really focused, and sometimes we forget the young adults. And I think that's a really good point. So I think there's opportunity there.
And so what, I know there's HPV infection or transmission. I once heard it because I know we talk about sexual activity and there can be some, biases or stigma associated with that early sexual activity. And so really understanding the cancer prevention aspect. But what about and I've heard it referred to as intimate skin to skin contact, right? So that it's not just necessarily traditional forms of, or like intercourse, vaginal intercourse, right? And so what can individuals do to protect themselves, that are sexually active, protect themselves from HPV infection?
Well, I would start right up and say vaccination, clearly, but I think we've got others here who are also probably very well versed in this. I mean, I think it is primarily sexually transmitted, so I think that's where a lot of our focus is. I think we, Dr. Naval may have some comments regarding obviously other forms of sexual behavior that might be resulting in transmission of HPV through oropharyngeal routes, for example. But I think there, in terms of intimate skin to skin contact, I think the risk is less. So I'm going to just pause there, I guess, and see what else others might want to contribute in that.
Yeah, I think like for oropharyngeal cancers, like oral sex is one of the common risk factor. And if somebody kind of prevention, before, that's why we talk about prevention, that if the vaccine is taken before the infection risk is there, then you can prevent it. And that's how you kind of can save, because many a times you don't know who has HPV or not, because again, there is, for women, we have Pap screening, but for men, we don't have screening. There's no oral HPV screening test that could determine if you have a high risk HPV strain or not. So I think definitely knowing is a power, and making sure that you prevent that infection before it occurs, because treatment is completely different. Here, what we are talking about is how do we prevent it before happening. Once it happens, I think there's a whole different course of thing that has to be doing after the case. But again, for oropharyngeal cancer, oral sex is a major risk factor. And if somebody is kind of HPV positive, that increases the risk of having HPV.
And I think it's important, I think Lillian had something to say here, but I think it's also important to recognize that in many cases, for example, cervical cancer, it's you can be infected and be asymptomatic and not be clearly infected, right? I mean, you can't tell. And that's, I guess, the way I would say it.
Lily?
Yeah, I wanted to say, and Kimberly knows this, there's a woman that we met. Her name is Kim McClellan. She has recurrent respiratory papillomatosis, and she didn't get that through sexual contact. That's through the birth canal. So that's another cancer. I'm not cancer, just another. She got HPV that way, and she's always saying she's wondering when she's going to get lung cancer. She's had over 250 operations on her larynx. And that's something that in the HPV world that's not talked about much, or people don't even know about it.
I guess your active point, Irene, as you're saying, is intimate, right? I mean, it is intimate skin to skin contact. So just use that as a context, right? Whether it be with oral sex, anal sex, vaginal sex, it's that intimate, it's that intimate contact.
And there's a question. So what is the recommendation, or with that being said, then should everyone be vaccinated, even those that are married?
Yes.
I know you talked about exposure. And so we talked about even promiscuity, but it's not about promiscuity. It's about persistent infection.
So clearly the recommendation, if you're married and you're under the age of 27, I think you're recommended to get vaccinated. I think on the 27 to 45, I think it's interesting. I used to give a lot of HIV talks too. And one of the things I've always mentioned with the vulnerable populations is this idea of loving yourself first. And, you might believe you're in a monogamous relationship. You might believe, whatever the marriage constitutes for you, right? But to love yourself first means you protect yourself first, which means you get vaccinated, even though I think you should be open to discussing whether or not you want to get vaccinated.
Yeah, I would agree to that in terms of again, because we do know there are so many strains of it. So somebody is married and kind of have in terms of what your risk is also dependent on what kind of strains and which you can get. And many times you don't know those signs and symptoms of it. So I think that shared decision making comes into play for those above 27 years of age, for the same reason that if you kind of think that is the best way to prevent and be safe in terms of cancer protection and things like that, that would certainly make sense to get vaccinated.
I was just going to say real quickly, knowing your status is so important. I was never, even though I had gone to my gynecologist and I had gotten pap smears, I was never informed of being HPV positive or anything like that. So I think just knowing your status is helpful. So I don't know how long I had HPV. I really didn't. So at 42, I didn't know until I actually started showing symptoms. If I knew before, then there could have been lesser aggressive measures that would have needed to be taken versus what I had. So absolutely, vaccination is wonderful, but also knowing your status prior to vaccination, because I think Dr. Tan has said something about that as far as okay, well, vaccination if you have not already been exposed. So that's the thing. If you don't know your status, then it's one of those situations where it could be up or down. So the biggest thing is knowing your status and knowing where you are in this journey, as it relates to high risk HPV.
Yeah, and I think that's so important. I think, again, loving yourself, loving others here, right? But the other thing also is, knowing your status, you could say, I think you can still get vaccinated even if you are HPV positive, because as we know, there are other strains in the vaccine that might be protected against, and you can be protected against infection by those strains. And so that's something that obviously, that's again, that decision-making process, the conversation, right?
And yes, and so just to clarify, correct, the strains that are in the vaccine, there's 9 types that it protects from, but these are not the only types that can cause these cancers, but they are the primary ones associated in that high risk strain. So there's the other measures, and just kind of reiterating, as you mentioned earlier, there's primary prevention with the vaccine, and then we have the screening, and the secondary, there's other forms of prevention with the screening. For women, you have PAP, for a PAP test or an HPV test for cervical cancer. But Dr. Naval, you mentioned there is no screening for some of these other cancers that are routine. Some of them are hard to look at or identify or see lesions, for example, the oropharyngeal, or there's no routine screening that's covered. And so to that extent, the vaccine has been around for almost 20 years. I'll give you guys a moment to be on your soapbox. If there is an area of research that you want to highlight, what do you think? What would you kind of call out, say, we need to learn this, or we still need to identify this? If you wanted to mention one of those areas, we'll give you your 60 seconds.
Well, I hope you go around the table here, but obviously for me, I think there's some very promising research, obviously, on therapeutic HPV vaccines, right, which would be vaccines that actually can help cure the infection by stimulating your immune response against the HPV antigen, the antigen itself, even though you're infected. So I think there's some phase 2 trials that have been ongoing. So fingers crossed if you get a therapeutic vaccine, and again, the single dose that I mentioned earlier, I think it'd be so amazing, especially globally, if we can do this in one dose of vaccine as opposed to 2 or 3. So those are like the two big at least research areas that I'm fascinated about. But I think I'm going to leave it to the other wonderful members of the panel to kind of highlight their takeaways on this.
In terms of research, I think my kind of one of the area that I think a lot about is that screening part of it. Like, is there a way to kind of screen everyone with more simpler tests and earlier on? Like, for example, cervical screening is happening among women and kind of at certain age, but if there is a way to identify and make that screening a little bit more kind of available to everyone when it is oral HPV screening. There has been some work going on, but right now we don't have any kind of full results on kind of if that works and how that works. So that's one area. And my second area, I think the most I would love to kind of really get more understanding of, which we are trying to, is vaccine hesitancy, and trying to understand that in spite of having a lot of robust information, robust data about it, these hesitancy happen in different way in different groups, and there are different reasons for it, for very sure. So I think opening that more and understanding that at a variety of levels could really help to kind of close that gap of moving from wherever we are in terms of vaccination rates to the numbers that we are trying to get to.
And so I'll also throw it to Lillian and Kimberly as well. Are there areas that you feel would be, research could tackle to address some of the challenges that you've experienced as as a patient or even as an advocate in that space?
Well, I definitely love what they've said. I mean, they probably took the answers I could have said, but single dose vaccine, I think it would be a game changer. To be totally honest, I think there are probably a lot of children that have gone and their parents have taken them for that one dose, but just have not been able to get them back. And it could be that they couldn't take off work. Some of the reasons why women are being staged, and I can really just speak from a cervical cancer space, but some of them are being staged much later. And some of that is because they're not going to the physician or not able to get to the physician until there's active problems. And so they're having these issues, they're having active bleeding that's not associated with their cycle. It's like, oh, well, let me go in. And that's when they're seeing it, and it's in later stages. But being able to have like a single dose, or, and sometimes just those areas, those rural areas where there's not a physician, if there's a way to even get the vaccine to them by having some type of vaccine clinic, or taking what are those mobile trucks and being able to vaccinate that way, especially in those areas where there's not a lot of access. And I think that that's an issue that we're having, and that we're seeing a lot of when we're talking. We're actually here at a retreat in DC, Survivors putting on, and we're talking to communities of color. Part of the issue there is access to treatment, access to vaccination. And I think that that's something that would need a little bit of research to see what can we do to get that uptake in those areas.
Lillian, did you have an area you wanted to add?
Okay. My area is just, I think, again, know your body. And I think just try to normalize the conversation so it's not such a big stigma. I remember, living in New York City and then visiting friends in the suburbs, different lifestyle, and telling them, oh yeah, I had got cancer from HPV, and they were all like, oh, but really, they weren't talking about it because they're just, it was just different. And then when I started to talk about it, then it became normalized. So I just think to normalize HPV, the conversation, and that it's the most pervasive virus out there that we all pretty much have or are going to get from just normal behavior. That you're not doing anything wrong, you're not a bad person, you're not being punished, and to be aware if something's bothering your neck, and just, don't blow it off, and other things, and to go for your screenings, and again to be on the lookout for people who are of the kids and people who are of the age to get this vaccine, to make sure they get it. I myself, when I talk to people and they have kids, oh, did your kid get the vaccine? They might not like me if they're against the vaccine, but I don't really care. I try to educate them so that they know they have a different. I have a woman who's has kids that should be getting vaccinated. She lives in Florida, and she's like, I didn't get them the COVID vaccine, and they haven't gotten sick, and all their friends got sick, and and I don't need to put anything in their bodies. And so I invite her to a board meeting I had with American Cancer Society, showing the rates of decline because of the vaccine. So that's how I try to combat. I'm not going to fight with them, but I'm going to say, oh, come here, let me show you something, kind of thing. So that's my recommendation.
Thank you so much, everyone. LJ, you're unmuted. Did you have something you wanted to add, or?
Nope, I forgot to mute myself.
Okay. No, that's fine. Thank you so much. We're running, we're at the end of our event. And so we want to thank our amazing panel for all of their time and insight and being with us today. Also, thank you to Merck & Company for their support of this event and SWHR's vaccines program. We cannot do this work without the expertise and contributions of our science networks, particularly our HPV vaccine education working group members who contributed to the development of the SWHR Talks HPV video series. This online tool was created to help parents and guardians learn about the HPV vaccine and cancer prevention by sharing facts and insights from immunization experts as they answer key questions relating to the HPV vaccine. It dives further into topics like HPV vaccine safety, school requirements for the vaccine, boys in the HPV vaccine, and also that shared decision-making for adults considering the HPV vaccine. So you can visit the SWHR website or our YouTube channel at Women's Health to view the series and download supporting materials. We will be sending out an email with a recording of today's public forum to all registrants, as well as a link to our hashtag SWHR Talks HPV video series. So please be on the lookout for that. To all our viewers, live and recorded, we want to invite you to connect with us on social media and visit our website, www.swhr.org, where you can register for future events, download women's health resources, and sign up for our newsletter. Let's continue this very important conversation with hashtag SWHR Talks HPV and SWHR Talks Vaccines. Thank you so much for joining us.